Ontario's top doctor is warning about potential outbreaks of measles. A memo from Dr. Kieran Moore, Ontario's Chief Medical Officer of Health, is urging public health units to be prepared for more cases. It comes amid a rising number of infections in Europe. Dr. Moore says there are 4 active cases of measles in Canada, including 2 in the Greater Toronto area. Both of those cases involve children who recently traveled outside the country. Let's bring in Dr. Isaac Bogoch, infectious disease specialist. Doctor, thanks as always for joining us today.
My pleasure, Roger.
I know a lot of people are going to look and hear the number 4 cases in Canada. That doesn't seem like much, but it is a concern.
It absolutely is. We have to remember that measles is a very, very transmissible infection, probably the most transmissible infection on the planet, and that it can have very negative impact. It's not the benign infection that some people might say it was. You hear people say, oh, decades ago, everybody got measles and we got through it. But we have to remember that it can cause significant morbidity and mortality as well. It kills 140,000 people per year on the planet. Most of them are kids. All of these are preventable. So we have a safe, free, widely available vaccine. We have to maintain vaccine rates above 90%, preferably above 95%, and then we can avoid any outbreaks in Canada. But we still have to be vigilant for these.
What are our vaccination rates right now? Have we seen them drop over the last couple of years?
Yeah, certainly with the pandemic, many people have missed routine vaccinations. We also see the rise of an anti-science and anti-vaccination movement that's it gained significant traction over recent years, and people are choosing not to vaccinate themselves or their children. So this is a growing problem. In general, our vaccine rates for measles are rather high throughout Canada, but of course there are always pockets and areas where vaccine rates are lower, and those places are susceptible to outbreaks. This infection will find a way. We've got measles. The WHO warned a couple of days ago that there's a pretty alarming rise in measles globally. Couple that with incredible human mobility and travel, including to and from Canada. And that puts Canadians at risk for imported cases. We'll be okay if we have high vaccine rates, but if vaccine rates dip, measles will find a way and we'll see local outbreaks here.
When is the best time for kids to get vaccinated? And should older people be looking at maybe to see if they need an update, a booster?
In general, children are vaccinated around the first year of life, and they receive another vaccine about a year or a couple of years after that. So it is a 2-dose vaccine. Families who are traveling who have a child who's younger than a year, you can get that first vaccine dose at about 6 months of age if people are traveling, especially to an area where there's measles. And in general, people who have had measles in the past have immunity, and those individuals would not need, for example, a booster vaccine based on the information that we have to date. So the key thing, too, is to remember that many people might have missed a vaccine dose throughout the pandemic. So it's a great idea to check those vaccine cards and talk with a healthcare provider or a public health specialist to see if they need an update. And also people born in so the second dose of the measles vaccine was really rolled out in 1996. Some people might think they've had 2 doses, but they might only have had 1 dose. So it's important to check that vaccine card and talk with a healthcare provider to make sure everyone's up to date.
I will take a look at that. Any concerns that it's mutated at all, and maybe that's an issue too, or is it still essentially the same measles that we've known for decades?
From a practical standpoint, it's still the same old measles. Of course, from a very technical standpoint, yes, viruses do change with time. But from a very practical standpoint, our diagnostic tests work. Our vaccine is still extremely effective. I can't stress this enough. This is a very, very effective, safe, free, and widely available vaccine. 2 doses of a vaccine provides upwards of 97% protection.
Okay, well, get out. Everybody should get an update on their vaccinations. Dr. Bogoch,
Absolutely.
as always, thank you for your insight.
My pleasure.
Dr. Isaac Bogoch, infectious disease specialist.